Hello, my name's Naomi May. I'm nurse consultant for Hampshire CAMHS.
My name is Lizzie Christie and I'm a nurse specialist in Havant-Petersfield CAMHS team.
Today we're going to talk to you about attention deficit hyperactivity disorder, also known as ADHD. This presentation is specifically for parents and carers of young people with ADHD and teaching staff at schools. We're going to be particularly focusing on what to look for, top tips and where to find help.
So Naomi, I'm really interested to know, what does ADHD stand for?
So, ADHD stands for Attention Deficit Hyperactivity Disorder. Children and adults with ADHD have problems paying attention, sitting still and controlling their impulses. It's a developmental disorder of self-control and consists of problems with attention span and impulse control and activity. I do wonder, Lizzie, though, if there's a better definition or a different way to describe it.
I think sometimes the young people we work with find it really helpful to think about it as a problem with putting the brakes on things, so a problem with inhibition. Children with ADHD are relatively brakeless. They can't put the brakes on distractions, so there's more inattention. They can't put the brakes on their inside thoughts, so there's more impulsiveness. And they can't put the brakes upon acting upon distractions and thoughts, so they're more hyperactive. Who gets ADHD?
Okay, so there's no diagnostic or blood test specifically to determine ADHD. The most acceptable theories with strong scientific evidence links ADHD to neurological differences, so difference in the brain. The role of dopamine in supporting the transmission of messages across nerves synapses is considered to be an aspect of ADHD. So usually people with ADHD have less dopamine levels in their brain, and so they're not able to respond to things in the same way that other young people would. There is a lot of links or a lot of evidence to show that ADHD is hereditary. So often you would see ADHD in other family members, maybe parents, aunties, uncles, grandparents, often in twins, and this has all been evidenced in genetic studies. So I was wondering, as we've talked about what ADHD is, would you be able to tell us a little bit more about what we'd be looking for with a young person who has ADHD?
So I think we think about the three domains that you've mentioned, and we can think about, what does a child who's inattentive, how would I notice them? So often they find it really difficult to give close attention to detail. They get easily distracted by external stimuli. For example, a door banging outside of a classroom. They can be really easily off task, and that can be from schoolwork or cleaning their teeth in the morning. They can often make careless mistakes and find it hard to stay on task. They can have difficulties listening when directly spoken to and find it really hard to follow instructions. They're unable to complete tasks and find it really hard to get organised. For example, you might ask them to get a bag ready for their swimming lessons and they end up at the lesson without a costume or a swimming hat. Another task they find difficult is anything that requires them to mental effort over a sustained period of time, and that can be during a whole class lesson of maybe 45 minutes. They can often lose items needed for those tasks, so they might forget their pencils or their pens. They can also be really forgetful in daily activities. So getting dressed in the morning, finding their shoes and getting out of the door on time can be really difficult for these children. Often these children can be overactive. They can't sit still as long as their peers. They are often up out of their seat or perhaps hanging off the seat. They can run and climb where it's not appropriate. And they can be fidgeting with their feet and their hands, pulling out items of clothing. They are often described as on the go, as if driven by a motor. These children are often really impulsive. They find it really hard to wait their turn, either in a queue or in turn in conversation. They find it really hard to stand in line without becoming distracted, and they can be very talkative, often at a volume much louder than other children. and they find it hard to engage in tasks where they're meant to be quiet. For example, going to a library.
So we're going to talk about some of the comorbidities, so some of the things that young people might actually have instead of ADHD. So when we're thinking about assessing for diagnosis, we would be thinking about what else could the young person have. This list is not exhaustive, so we would be thinking about things like obsessional compulsive disorder, oppositional defiant disorder and conduct disorder, bipolar, dyslexia, dyspraxia, tics or Tourette's, autistic spectrum condition, so often there's a link with young people with ADHD who also have autistic spectrum condition, attachment difficulties, Erlin syndrome, anxiety, speech and language disorders, sleep disorders, substance misuse, behavioural difficulties, sensory or auditory processing disorders, trauma, developmental delay, and chromosomal abnormalities. This list is not exhaustive. We would also think about other things such as epilepsy.
So far, what we've spoken about are a typical presentation. And as with many things in life, there's no one way that these children will present to us. There are some certain factors that are really important for us to hold in mind when we're considering a diagnosis of ADHD. One of the big things is the differences in how little boys and little girls or teenage boys and girls present. Noticeably, girls can be less hyperactive and perhaps more inattentive, but it's worth remembering that not all presentations are the same. Certainly, it's important to understand how life has been from the children since they were born, and it can be really hard for parents or carers to recall details that can be important in making a diagnosis for ADHD. And for those children who are looked after, there might be gaps in their history that make it hard for us to know exactly how their presentation would have been, perhaps as an infant. Sometimes, for a variety of reasons, class teachers or schools may over-report or under-report the presence of symptoms. We know that an attuned, sensitive parenting style might impact on the presentation of the young person, with perhaps their symptoms being less impairing than children in other situations. Socioeconomic factors are an important consideration, along with making sure we hear the young person's voice in the process of assessment. What do the difficulties mean for them, and how do they impact on their lives? As Naomi mentioned, we need to think about other possibilities that might better explain their difficulties with inattention, hyperactivity and impulsivity. And of course, there's always Google, a minefield for giving possibly incorrect information.
Okay, so now we're going to talk to you about some helpful daily techniques in supporting and helping manage behaviour of young people with ADHD. So I'm going to be talking to you about some general techniques, and then Lizzie's going to talk to you about some specific techniques for the classroom. Now obviously we need to consider that when a young person is diagnosed with ADHD, they could be anything from the age of 5 up until the age of 18 or into adulthood. And different techniques work for different age ranges depending on their developmental stage. So some of these techniques will be useful for young people under the age of 13, some will be able to be transferred to the adolescent population. So, the other thing we need to take into consideration is that some young people with ADHD, because of their interaction with the world and how the world has responded to them, they have become quite emotionally sensitive. This could be because some of their behaviour has caused them to get into a lot of trouble at home or school, and also kind of affected their friendships. So when we're considering techniques to support them, we're very mindful that some of these young people can be more sensitive than some of the general children's population. So when we're communicating with young people, it's very important to give them eye contact so that they know that you're talking specifically to them. Non-verbal cues is a very good idea, so arranging with a young person how you might indicate that they need to slow down, or that they're doing something that needs to be corrected, or that you're expecting something different of them. Give young people advance notice of a change that's going to happen. Give 2 choices, so I'm expecting you to either do this or do that, and then they have some control about which choice that they would like to make. So an example of this could be, when you come home from school today, we need you to do your homework and then you need to have a shower. Which one would you like to do first? An indirect approach with a young person can also often be very helpful, and frequent praise for things that they've done right. When a young person is being on the go as though they're driven by a motor, or they're very talkative or being very loud, or they're responding negatively to something you've suggested, it's important not to take the child's behaviour personally. Lots of eye contact when they've done something well, or when you're talking to them, because they know again that you're specifically referring to them. Reduce eye contact, however, if you're feeling really cross with a young person, because if they know that you're feeling cross and you're giving them lots of eye contact, they can interpret that as very confrontational, and that can exacerbate the situation. Make sure that you spend one-to-one quiet time with the young person. We have to remember these kids are often on the go all the time. They're overstimulated by noise in the classroom or at home, and sometimes just having special one-to-one time with a parent or a carer or a family member or a teacher can be really helpful to help them calm down and feel valued. When you're asking a young person to do something, use the one-sentence rule. So if you give them very overcomplicated instructions, like go upstairs, make sure you pack your bag for school, clean your teeth and then come downstairs, they'll probably go upstairs and then forget what they've gone up there for. So make sure instructions are very clear and only with one instruction at a time. Time out can work, but not always when a young person's sensitive, because it might make them feel that they're being excluded and they're being really told off. So sometimes having a different version of time out, going with them into a different room might be helpful. Using we words. So how do you think we could change our behaviour? What do you think we could do differently? So not always making it about the problem in the child. With all young people, but particularly ADHD young people, we need to be very clear about a daily structure and clear boundaries, because this will help a young person know what's expected of them. Their lives tend to be very busy, very noisy, very chaotic, but having some structure around them will help them to structure their day a little bit more effectively. Sometimes if a young person is sensitive, physically touching them when they're heightened emotionally might worsen their behaviour or might make them more upset. So sometimes if your young person is upset and having maybe a meltdown, be there and be available, but don't necessarily go to hug them or touch them. Focus on positive behaviours. We need to remember as well that children with ADHD, and in fact all children, often forget messages relayed between different people. So there might be a problem with messages relayed between school and home, and they might be forgetting significant information, which would then lead them to getting into trouble with a parent or a school teacher. A way to help with this is a daily communication book where things can be written down, so the onus is not on the young person to remember. Remembering young people with neurodevelopmental differences can often find change difficult to cope with. So talking about friendships and play now, young people with ADHD sometimes might appear socially out of tune. They might love football, they might like the idea of playing with their friends or playing team sports, but in reality they can often dominate situations, can't concentrate, can't listen to instructions. So it might be that group activities are less suitable for some young people. Now obviously we need to think about young people as individuals, so not one thing fits all, but sometimes if somebody is enjoying physical activity like football or cricket but find group activities difficult, think about what they could do one-to-one instead, something like running or a martial art where being part of a team is not so important. Look for opportunities to raise a young person's self-esteem. So that goes on to what I was referring to previously about getting young people involved in activities, helping them burn off some of their energy, spending time with them and doing special things that they like doing. Gradual internalisation of feelings of approval and affection helps young people build a sense of self-worth. Often these young people are children that get into trouble a lot, and they can start having very negative feelings about themselves, and leading into adolescence this can lead to other comorbid mental health problems. Play, interactions and social skills are all learning opportunities for children, and I would particularly be thinking for young people in infants and junior school that learning through play is a very good way for young people to learn what's expected of them and how to be with other people. Use imaginative play as a form of education, particularly with the young children. When you're playing with children, make sure that you follow your child's lead. Pace it accordingly. Don't compete, because young people with ADHD often feel like they're having to compete with other people in their peer group. Role play and make believe with your child. Laugh and have lots of fun. Reward quiet time with your attention. Praise and encourage, and try not to criticise too much. Encourage problem solving and tell them when you've enjoyed spending time with them. All of these are opportunities for making a young person's self-esteem become much more robust, instead of always thinking that they can't cope or they're always in trouble. So with all children, but particularly with young people with ADHD, they often have difficult behaviours. So we need to think about some techniques to manage those difficult behaviours. So we've already talked about time out, working for some people to calm down, but you might need to think about how you manage that time out period. Be reasonable with the consequences, ensuring that if a child's done something wrong, they understand what they have done wrong and what the consequence is. When you're developing consequences for young people, make sure that they are realistic and don't make threats of something that you've got no intention of carrying out. So, for example, if you don't do this, you're not going to be able to play the PlayStation for the next 2 months, when in reality you'd find that very hard to stick to. So make sure that they're small, bite-sized and rational consequences. Don't send a young person to their bedroom for absolutely everything they've done wrong, because then they spend all their time up there. Think about different ways to manage poor behaviour. When the child is calm, then use that time to talk to them about the behaviour that they did, and think about ways with them about how they could do something differently. Remember, it's the behaviour that you want to change, it's not the child you want to change. One of the most important things is making sure that all adults working with the young person or living with the young person have a consistent approach. So mum and dad or grandparents and school teachers all have the same type of response to a young person, so they know what to expect, and they can't do one thing in this environment and one thing in that environment. If you're helping a young person who's got into trouble to problem solve, think with them about what could you have done differently. Can we think together about ways that we could behave differently if this situation arose again?
So it's really useful to remember that all the strategies Naomi has spoken about earlier are absolutely relevant to all situations that children and young people may find themselves in. But now we're going to consider some more specific strategies that might be helpful for young people in a classroom setting. It's really important that communication between home and school is effective and timely. One of the things that can cause difficulties for both teaching staff and parents, and then subsequently the young person, are if there is miscommunication between settings. And a strength-based approach can be really useful, remembering to tell back times that children have succeeded and done well, rather than focusing on what hasn't gone so well all the time. Working together with parents, you can identify strategies that work for that individual child. As Naomi mentioned, all children are different, and one set of behaviour strategies will not necessarily work for another child. Regular reviews are necessary to adapt the strategies in place for young people. As children grow and develop and mature in all areas of their development, their needs will become different. And therefore it's really important to regularly review the things that are being used, how successful they are, or indeed when they stop working. Okay, so now considering some specific classroom accommodations that might be helpful. Firstly, the physical environment that the young person finds themselves can have a real factor on how their behaviour is during a lesson. So the classroom setup. Firstly, if you can sit the young person away from obvious distractions, this can be really helpful. So perhaps a more centre front of a classroom can be a good place to find themselves. Utilise other positive role models in the class. If there are other young people who find it easy to follow instructions and stay on task, perhaps it'd be useful to sit the young person with ADHD in the vicinity of this young person. And increase the distance where possible between desks or away from windows where there's blinds, or indeed where there are other distractions that children might find themselves easy fiddle toys with. For assignments, it may be useful to consider that the young person needs some extra time. And if long assignments to be produced over a period of weeks are broken up into smaller parts, young people might find that they're able to complete the small parts and then move on to complete the larger assignment. Pairing written instructions with other kinds of instructions can be really helpful. Some young people with ADHD find that they miss instructions if they're given in a verbal manner. So perhaps writing cue cards or using colourful pictorial presentations might be helpful for the young person too. Distractibility can cause problems for the young person in accessing their learning, as well as often disrupt other members of the classroom. Provide peer assistance in note-taking and ask students questions to engage them in the topic of learning. Involve students in lesson preparation. Get their view on what might be helpful to them to stay on task. Queuing students in with a private signal can be really helpful, as often they may well be focused on what's going on outside of the window or outside of the door rather than what's happening in the classroom. And scheduling 5-minute periods to check in with the student prior to work being handed in, just to check they're on task, can also really help the building of self-esteem so that young people can more consistently achieve the goals that are set for them. As Naomi said, behaviours which are small and less distracting can be ignored. Increasing the immediacy of rewards for the behaviour that you want is really useful for young people. And indeed the consequences for behaviours that you don't want need to be immediate where possible. Acknowledge correct answers only if the young person has kept to their side of a contract in terms of perhaps putting their hand up or waiting in sequence for their answer to be given. And send daily or weekly report cards home so that families can be involved and have a knowledge of what's going on for that young person at school. Make sure that any behaviour contracts that are set up are achievable and manageable for the young person. When considering organisation and planning, young people with ADHD can find this particularly difficult, especially when they reach secondary school. Practical solutions such as coloured binders with dividers, different books for different lessons can be really, really helpful. As can having a duplicate set of books and assignments at home as well as at school. This helps limit the chance to forget equipment needed for certain lessons. A special book to write down assignments can also help make sure that young people know what they need to do. Sometimes if they are relied on to write the information down in a planner or a homework planner, they might miss key parts that are important for them to complete the task. Allow students, as we've said, to keep duplicate sets of pens, pencils at home and at school. And allow students to run errands in the classroom, in the school day, to help them feel important, valued, but also to give them a chance to use up some of their energy. Where necessary and if appropriate, short breaks can be really useful, not only for the young person with ADHD, but for other children in the classroom as well. As we spoke about, a sensitive temperament often is associated with ADHD. Set up social behaviour goals with the student and implement a reward programme. Encourage cooperative learning tasks within a classroom environment, and perhaps again choose positive role models for the young person in the group that they're placed in. Assigning special responsibilities for the young person with ADHD can help their self-esteem. Also, things like holding back a heavy door, carrying books to a staff room gives the chance for the young person to regulate how they're feeling and manage their excessive movements. Complement positive behaviour and work and give the opportunity for friendship and leadership roles. Frequently acknowledge when you see the behaviours that you want. Encourage students to walk away from situations that are leading to them feeling angry. So now we need to think about, if you have a young person with ADHD or who you think might have ADHD, where can you go for help? The importance of working together cannot be underestimated, and that includes with the young person, with their family, and with key professionals. An ADHD diagnosis depends on impairment of symptoms across settings, so knowledge of how children present in different arenas is really important. Include as many people who know that young person as possible to gain an understanding of how they behave and what helps their behaviours in different settings. Where possible, gather examples of their behaviours and the impact of these behaviours in a variety of different places. Okay, so while collecting the information you need to help you to best identify what's going to be most useful to the young person, it's important to speak to people, other people who might have information about that young person. Parents and carers, siblings if appropriate. Often an older or a younger sibling can have some really useful information on their understanding of interactions with the young person. Teaching staff, teachers, LSAs, SENCO, homeschool links often have invaluable knowledge on how a young person is succeeding or otherwise within a school setting. There may be other health professionals already involved with the young person, or indeed those who have previously been involved with the young person, such as a health visitor, a school nurse or a paediatrician. And obviously a GP can be a key link to having all this information. Behaviour support services may have been employed by your child's school. They're another useful contact, not only to understand what's difficult for the young person, but for understanding things that have helped them. There may be children's services or a family support worker involved with the family, and other people really important to that young person, such as a sports coach or a brownie or cub leader, might not only again share information about how that young person presents, but be able to identify some real strengths that those young people have. So where can you go for help? Parenting support groups can be a really useful first step for helping parents and carers manage some behaviours that can be quite difficult and impact on all members of the family. Locally in Hampshire, Barnardo's provide a variety of group support for parents and carers of young people with ADHD, both prior to and following the diagnosis. Schools may have a varying degree of support available to the young people and to parents. They may also be able to access other support that will help better understand the young person's needs, such as an educational psychologist. Local support groups are available in local areas, and the website has further details on these, along with national support groups that can be helpful in understanding ADHD. Be aware with any online resources that they come from a credible, referenced support system, and you might need to ask the SPA, the single point of access at CAMHS, where those online resources can be found.
So to wrap up, we're going to think about when to refer to CAMHS. If a young person has got evidence of difficulties with the domains we've talked about, inattention, hyperactivity and impulsivity across settings, so we would see it at home and school and other settings, after the age of 5 years with little or no improvement, after they've had interventions both at home and school, parenting support, so one of the parenting support groups at Barnardo's as an example, a period of watchful waiting to see how they're managing in the school setting and at home, and if their behaviours are leading to increased risk, then we would consider looking at the ADHD minimum clinical standards and our referral criteria. Okay, so we have ADHD minimum clinical standards in Hampshire CAMHS and Sussex CAMHS, which include our referral criteria. We follow the National Institute of Clinical Excellence, also known as NICE, guidelines in thinking about our management of young people with ADHD. Sometimes when all the aforementioned groups, support groups, ADHD parenting groups and support at school has been accessed and a referral to CAMHS has been necessary and accepted, we would think with some young people who are more moderately to severely on the ADHD spectrum, there might be a role for medication. We would only consider medication after other non-pharmacological things have been tried, both at home and school. We hope that you found this presentation useful, and as Lizzie previously mentioned, there are other resources out there in the community or can be accessed through our single point of access team. Thank you.
Thank you.